Thank you, Mbak Sekar. This is my presentation, ladies and gentlemen. Good afternoon and good evening. Now, this is the. I just want to introduce about the SONJO, and especially we'll discuss about the role of SONJO in health. And later on, my colleague Mas Gumilang would like to express it in economics mostly. So basically, we start from here. This is the way we perceive the COVID, and if we see the COVID is basically it's like when the nature change or the state of the world change drastically, and obviously we have to adapt to the new state of the world, and don't expect to return back to the pre-COVID era, because if we still thinking about that we move back to the pre-COVID era, that's basically we will not do any adaptation, we will not do any innovation. So this is the flyers that was laying around during March to last year, and when I see that, at first I'm just thinking, is it true? And I doubt about that, because one is that basically indeed that we are in the same storm. I agree with that, but we are not in the sea, and we are linked by internet. And in the old days, we have the what is called sambatan. This is the way, like a social capital that's been rooted in Java, and of course also in across culture in Indonesia. We do have that kind of social capital actually. Now the question is that how can we use internet in order to reuse again, or trying to reinvent again the sambatan. So this is the way we perceive as well, whether we want to see this as a disaster or as a war. So I'm thinking about more in a war rather than the disaster. And what are the dominant strategies? There's three things: expect the unexpected in terms of the impact, and then thinking into it innovatively in terms of the solution. And the most important thing is how to do the resource mobilization. And if we see the resource mobilization, then the question is that let me count the resources that we have. And in Indonesia, of course, we cannot rely on 100% to the government, because the government budget obviously will not be sufficient. So the question is that how can we use how we can mobilize the resources from the household and also the businesses. So that's why we use the way the Sambatan Jogja or the SONJO. Yeah. So this is the Sambatan Jogja, and we have, what is the focus? So basically, we have what I call the mission-driven organization. So we focus on the vulnerable people and people at risk during the pandemic, and we're trying to help them. And the value is based on the integrity, transparency, empathy, and also the synergy. And why do we use the Wasab? Because everybody uses WhatsApp. Most people in Indonesia are using WhatsApp, so it's easier for us to contact people and discuss with people through WhatsApp rather than using other media. And on the average, Indonesian spend 3.5 hours basically in social media. And then the question is that will it be possible that everybody spend about half an hour, to do social work, something like this. So this is the idea basically behind SONJO. Now this is the 19 WhatsApp group. So 2 weeks ago, Pak Sabu attended the webinar. It was 18 WhatsApp group, now become 19 WhatsApp group. It's growing quite fast. It's because of the needs that we have in the field, basically now. And this is the development, and we do have the compliance committee. So we start with the one WhatsApp group, and then it's become it's growing quite fast to be 19, and we also have a compliance committee. So the compliance committee actually to ensure that there is no moral hazard or anything in a SONJO. And we use the website, database, apps, and social media. We utilize all of them basically in our movement. Now the question is that is it does SONJO is related to charity? No, we are not charity, but we are a movement. So I'm sort of like a self-help group, basically. And we don't receive any funding until now. So how do we do it? So basically, we just the way we do it is like sharing responsibility. So we start with the notion that everybody has resources. Now the question is that how can everybody contribute their resources in terms of the time, in terms of the willingness to sacrifice and willingness to help others in the SONJO. And we don't use any funding whatsoever up until now. So in a way, we create what I call the public goods, basically. And why is it that this one is public goods? Because look, when during the pandemic, it's actually many people they have lots of burden, and the transaction cost is very high. Now, how to facilitate the transaction cost is how to reduce that is by creating the public goods for everybody. Okay. Now, this is the learning curve, and the learning curve is quite fast. Actually, we start from something simple, and then we follow the process, and then we scaling up. And now this is the one that's very important. Actually, is the knowledge management, and the knowledge management is based on three programs that we have. The first is the Angkringan. The Angkringan is like a webinar, a weekly webinar, and we reach until episode 56. So every single week we do that. And also the Mikunani. Mikunani is actually sharing skills among members. So if you have any skills and you want to share with everybody, please feel free to do so. We put it in a Zoom and then upload it in YouTube, and then we upload again in our website, and everybody can use it. Everybody can access that. And also we have a SONJO Kebijakan, which is a policy. Now this is the only WhatsApp group which use Chatham House rule. And we talk to the government, we talk to the central government until the district government and also provincial government. And so this is the way we do in terms of the knowledge management. So in terms of the coverage, that we work on the three sectors, which is health, economic, and education. And these are the program in health. So I just want to concentrate in health. So we have 11 program. And I want to introduce not everything, but it just start from number 5. I think that's more important, because so this is start from number 5, which is how to manage the corpse, the infectious corpse, basically, because this is quite daunting actually, and that's create conflict in society if you don't do properly. That's why we create this kind of program to disseminate to people. And also we have a database, and this database is basically about the referral system. We help the government in creating the database for the referral system across the hospital at that time. And why is it that this happened? Because during December until February, we have such a patient at that time. Now this is you can see the database is look like this, and also we have now this one is the SONJO Jose Tango is basically the way to finance the some of the activities, and mostly we trying to support the shelter, the existence of shelter. Do we receive the funding? No, it's actually we have many donors who would like to join, and then people pay to the donor, and then the donor pay pay directly to the shelter. So we don't receive any funding whatsoever. And then we have also the database for the shelter in Yogyakarta. At the moment, we have 60 shelters across Yogyakarta. 2 districts joined with this program, which is Sleman and also Bantul. Yeah, and in shelter, and then a village shelter, sub-village shelter, and also pesantren. Now, pesantren is the Islamic boarding school. Okay. Now, of course, the implementation is quite varied from one region to the next. So what we do is basically we adapt to the system that take place in the region. Now, we also have this. This is the pilot project for managing the infectious. What is that? The infectious waste. Yeah, and we work together with the village in this kind. And then we also have the what I call SONJO Pasar Desa. So SONJO Pasar Desa is actually, this is the way to help the shelter with the operating costs, especially the food costs. So the way we do is just basically we help them with the package of food, and then this is for every single patient. They receive about £9 basically for 10 days, and the Women Association will cook for them. So this is the way we do. And the Pasar Desa is actually the marketplace that has been created by the Panggung Show. And last is about the Sonjo Saras. This is the last program that we have. It just emerged last Friday, and this one is the way we're trying to help the pesantren, and also the village on how to develop the shelter, because we need to ensure that the quality of the shelter is up to the standard. So if I just close with this one, so basically if we talk about Sonjo, what is Sonjo? So Sonjo is like we provide a Doraemon pouch, so you can pull anything from there. Then we're trying to be trying to provide the public goods for in terms of health, economy, and education in relation to the tackling COVID-19. Okay, thank you, Mbak Sekar. This is it for me. Thank you.